Hi, I am Dr. Pamela Lindor. I'm a pediatrician and currently with Bluebird Kids Health in Jacksonville, Florida. I've been a pediatrician for 32 years, originally from the Northeast. I practiced in Massachusetts for a long time and have been in Florida since 2013. So I really enjoy practicing peds. Ever since I went to medical school, I knew I wanted to work with children. That's been excellent. I feel like I've learned a lot over these years of practice, and both as a parent and as a pediatrician, I've gained a lot of experience, and I feel like I have a good perspective now, and I really like helping parents navigate their way through raising their children. What I like best about pediatrics is that kids are open, honest, and fun. I feel like you can be yourself more when you work with kids. By being able to relate to and interact with the kids really well, you can gain the trust. Parents tend to trust you when they see that you're able to interact with their child. I think parents they develop a very strong attachment to you as a pediatrician because it's hard to know. It's hard to know as a parent if you're doing things okay or if your child's doing okay, and that reassurance means a lot to them that I can give them that. So when parents are overwhelmed, I think one of the most important things is that they know and sense that you understand that and that you acknowledge it, recognize it. Advice that I like to give parents or that I want to convey to parents is that they should try to trust themselves, that they do know their child better than anyone else, and that they should try to trust their instincts, and that they should not be too rigid in feeling that there is really only one way to do anything. Because of this expert culture that we have, I feel like a parent may have read a book or read something online that says, your child should be doing X by this time. And if they're not doing it, the parent is worried that, either there's something wrong or that I'm doing something wrong. Giving them that little bit of reassurance and permission to say that really every child really is different, and that if you're comfortable and your child is thriving and I'm not finding anything wrong, that it's okay that this is a little bit different. Being in medicine for 30 years, I've seen a lot of evolution in the way that we interact with our patients. And I think that for the most part, it's for the better. We have a portal that patients can use to access the office. It continues to improve. They can send messages, they can send pictures, they can ask for advice as long as it's not something urgent. And usually they can schedule or reschedule appointments. We can send information that way as well. So we can send out some of the things that we recommend, either, questionnaires to fill out or advice for different ages, information about vaccines. So I think it's nice to have added layers of communication. There's still something important for most patients, I think, to be face-to-face. A lot of patients really want that, especially when they're dealing with, say, a well child check, where they're really here more for maintenance, monitoring, screening, reassurance, and developing that relationship. A fun fact about me that my patients may not know is that I have chickens. I just became a chicken mom, so it wasn't enough to have 5 kids. I had to have 10 chickens. It goes back to my love of animals. I'm trying to reawaken that. That's been a lot of fun. So the culture at Bluebird is open, friendly, teamwork. I feel like everyone understands the importance of everyone else's role, and that we really want to provide the best care we can as a team. When you come here, when you bring your child here, we want you to know that everybody is working for the same thing, that we're working to provide you excellent care and to be accessible to you and to be the place that you first think about when you have a concern about your child. This is an amazing opportunity to be able to provide really good care to all of our patients.